everyone. Happy Wednesday, happy Thanksgiving week, and welcome to GCC's Georgia Chiro Connection. I'm your host, Dr. Kathy, and today I'm super excited to be speaking with one of our speakers for our upcoming convention, Dr. Marianne Abate. Hey, Doc.
Hi, Kathy.
How are you?
Doing well. How about you?
Doing fantastic. Are you excited for Thanksgiving this week?
I am. I can't believe the holidays are already here.
It's flying by. This year is going way too fast. So with this year going fast, obviously we're getting close to our license renewal for Georgia docs. So as you know, this is a renewal year. You have to get 20 hours per year. Don't forget, 20 hours can be done online, but 20 hours has to be done in person, and you cannot do all 40 hours in 1 year. So hopefully you've gotten your 20 for last year. And we have our annual GCC convention coming up in just a few short days, December 9th, 10th, and 11th. In Marietta at the Atlanta Northwest Marriott. So with that being said, Dr. Marianne and her husband, Dr. Scott, are going to be speaking for us this convention weekend. So tell us a little bit about what you're bringing to us, because I am so excited to learn from you.
Well, I've been in practice for over 30 years, and I think anybody else who's been in practice in a family-based wellness practice has probably noticed that the issue of tongue tie is becoming more and more prevalent. It's very controversial across the medical field, dental field, with lactation and speech, and it's coming into my office quite often. And it's kind of funny because in my initial practice 30 years ago, I think I saw it just as much as I'm seeing it now, except now I know what it is.
So that's an important point that you bring up, because I think a lot of docs, if you don't completely focus on a pediatric population and you're just your general family practice, and you see everyone from newborns to toddlers, preteens, teens, adults, and elderly, if you don't specifically focus on pediatrics, I think that there's this misconception that a tongue tie would be so obvious that somebody would catch it. It would already be addressed by the time they came to your office, because there's the misconception that a tongue tie means that the tongue is literally attached to the bottom of the mouth, and that there's no chance that anyone would miss this because it is so blatantly obvious. But I know that that's not the case. And so can you help, for our docs that are listening right now, help them understand why it's not always so obvious?
You bet. It's a funny thing. Tongue tie has been around since the Middle Ages. In fact, there's biblical references of it. And yet it's come back into our consciousness in the last 10 to 15 years. And as this has happened, what has been revealed to me is I've been taking care of these kids all along, not even knowing it was a tongue tie. And these are the ones that we classically see as chiropractors, especially subluxation based, because these children don't come to us with back pain, neck pain, headaches. Parents are bringing them in because either one, they're not happy with their doctor's diagnosis or the treatment of, well, just give them drugs, or they've been told they need to have a surgical release of this tie in the mouth. And then parents are hoping not to have surgery, and they come to us as a drug-free, surgery-free profession. And so I have learned that when I see an infant that's not only having problems, because you would think with tongue tie, it's very obvious, they have latching, sucking, nursing problems. Maybe they reflux. Maybe they have tons of hiccups. But we also see the colicky baby, the child with ear infections. And as I have learned, all of these conditions that consult the chiropractor for reasons of chiropractic care are also being diagnosed as tongue tie with either their medical provider, but more than likely it's the pediatric dentist.
Really?
Yeah.
So it's interesting that you say that, because that is not a first stop for most parents. Most parents don't even think of taking their child to a pediatric dentist until they have a full mouth of teeth. Most people don't typically go when there's one or two teeth coming in. They wait till the child is 4, 5, maybe even 6 years old before they visit a pediatric dentist for the first time. That's a lot of developmental time that's been affected.
Absolutely. And what happens is it's been the lactation consultant, especially if it's an IBCLC, they have international board certification, they will identify the tie, and then they send the child to the pediatric dentist, who is in my opinion, the best to do the release. There are other professionals that will do it. If it is a tie that is caught on the front of the tongue, and this is something we're going to talk about in my class, is it's really hard to identify. There's two different classes of tongue tie. It can be on the front part of the tongue that we call an anterior, and we'll see that. That's a baby that can't stick their tongue out. It's a tongue that's heart-shaped. But when it's a posterior tie and it's more in the back of the throat, it may not be identified. So the hospital staff will miss it at birth. Mom will have problems with nursing. Then she'll consult the lactation consultant, who usually will send you to the pediatric dentist. Now, ears, nose, and throat doctors sometimes are referred to, but that's usually a little later when the child has breathing difficulties, plus they've already had this history of nursing difficulties, and if it's affecting ear infections as well, that's when the ENT will do the release.
So I know that there's more to it, and obviously I've had the pleasure of speaking with you to learn more from your perspective. And I know that there's more to it because it's not just as I've learned from you, the tethered oral tissue. There's more involved, and that's where it really becomes a chiropractic issue. So can you talk to us a little bit about that?
Yeah, well, it's one of those things that a subluxation can mimic a tie. And I really truly believe in my heart, a lot of those children who consult me that they are having reflux or GERD or constipation, colic issues as an infant, they end up having a subluxation if their jaw doesn't move properly. It can be a cranial subluxation. I work a lot with cranial bones on the children, working in craniosacral technique. And a lot of times these techniques will resolve the condition, diagnosed or not. In fact, when I look back to these 30 years that I've been practicing, I've taken care of many children who had a tongue tie that those symptoms were resolved by getting adjusted, because it truly can be a misalignment of those joints, not to mention the upper cervical being incredibly critical to that function of swallowing, breathing. The vagus nerve is there, the innervation to the throat and the mouth, everything that is there that can relate to the chiropractic adjustment. So whether or not they're diagnosed, whether or not they choose to have the surgery, we see these children get better in our practice. So as it became more prevalent, I've really invested a lot of time and energy into figuring out what is going on and how can we help these kids, whether it's preventing a needless surgery or it's helping them through that process.
In chiropractic, we often talk about how the adjustment helps to improve the function of the immune system. And so if these children are destined for the surgery and it is there is no other option, doesn't it stand to reason that getting them adjusted prior to and shortly after the surgical procedure, that surgical release, would be beneficial to them?
Absolutely. In fact, there's a whole new area of dentistry called airway dentistry, and it is focused on the anatomy of the mouth. And that's really where I started to learn more about tongue tie. I got invited to a meeting. This meeting is an interdisciplinary group of ENTs, orthodontists, chiropractors, massage therapists, physical therapists, and the lactation consultants and speech and language pathologists. So we get together and we talk about the anatomy and physiology of the mouth, the function of how it works. And really the chiropractor is who connects the function. The speech and language pathologist will work with that, but I'm able to explain to them how the alignment of the joints and those bones that are actually making the anatomy and the nerves that give it that animation of working for function, because it's not just about eating, it's breathing and it's swallowing. So these children end up mouth breathing, and they end up becoming adults that mouth breathe, and that gives them a whole host of, it can be ear infections, it can be enlargement of the tonsils and the adenoids, and these anatomical areas that relate back to this tie. But even just by adjusting the children with or without the release of the tie, we know they improve. Their ears drain from fluid. We know that they can breathe better. So chiropractic plays an essential role whether or not they get the surgery.
So most of us are fully aware of cross crawling and how that helps to establish the decussation patterns in the brain. So when a child crawls, it helps to stimulate both hemispheres of the brain. In some of my lectures, I talk about the suckling motion and how that actually helps with the hormone letdown and how that bonding with the mother affects their ability to produce oxytocin, not only as a child, but their ability for their body to recognize how to produce it later on. If they're not able to nurse effectively or eat properly, or they're having difficulty swallowing, how much of an impact does that developmentally have on their brains?
Well, it certainly the first relationship of life is going to be breastfeeding, and that trust and that bonding and security is critically important in establishing that. Plus, as chiropractors, we advocate that breast milk is going to be the perfect food. It's best. It has all of the nutrition that child needs to grow and to be able to fuel that action of growing. And then if they cannot do that, they end up bottle fed, which interrupts
Mhm.
the relationship. And that's going to translate into that parasympathetic rest and digest and relaxation as they bond, and that oxytocin, like you brought on. I also, I will mention to the dentist that the bone that is primarily involved in sucking is going to be the sphenoid. And as that sphenoid rocks in the cranium, what sits in it is the sella turcica with the pituitary gland, and that's releasing growth hormone. So when a baby can't suckle, they could have failure to thrive on the extreme end. They could have all kinds of interruptions in feeding, and then they end up being bottle fed. And we know that formula has aluminum in it, it has high fructose corn syrup. And as a wellness practitioner, as a chiropractor, that we advocate healthy nutrition, the ability to bond, that rest and digest. I feel like we're really the provider in the position to foster just better brain health and health later on in life.
I agree. Wholeheartedly, I agree. And I think it's so necessary for you to be stepping into this space, because I think a lot of docs really need more information so that we can better serve our communities. But we also need not just the information, we need the tools to be able to serve our community, because, like you mentioned, you're probably seeing the same amount of tongue ties now as you were 30 years ago, but now you're more aware and you're able to pick up on it. You're able to address it, and you're able to really afford a level of hope to these families.
Yeah, that's true. And like you said, with that cross crawl pattern, it's funny because the tied baby who isn't identified, because the first red flag is usually that nursing difficulty. The next red flag is speech. And at first, I went into it thinking, well, of course, if the tongue is tethered to the floor of the mouth, saying certain phonetic sounds would be difficult, like an S or an R, a TH. And we hear these kids that have this slight lisp or speech impediment, but it's really not that. And this is where I really think chiropractic fits in, because as we enable the brain to get the proper stimulation, and that means it has the body has full range of motion. That is what grows a brain to be its best and its healthiest. And so this child cannot acquire speech because they have problems with a weak core, weak tone, and that's why they end up not speaking, because that is really fine motor, or as opposed to just gross motor development. So we really fit into the development of these children that become speech therapy children, speech and language pathologies. They don't swallow well. And
Mhm.
then that'll even translate into that teenager coming into the chiropractor with ADHD, with learning disabilities, sensory processing disorders. We're going to cover all of that in the class. How, if it's not caught early, we just keep growing, and we even become adults that have anxiety and problems. So we can live. My thought is, I want to help these children thrive. I don't want them just to survive. And certainly, chiropractic helps us survive on every level and even thrive. But when we can help this medical condition through our perspective of vitalism and chiropractic, it really helps them to recover and have a much better life because of brain health and nervous system.
Fantastic. I'm glad that you use those words, because for many years we've had a saying in Georgia, especially with Life University being right here, to help people get out of survival and into thrival. And that's really one of the big things that chiropractic does. We offer people help, but we also offer them the ability to function at such a greater capacity that they're not just surviving, they are absolutely thriving. So thank you so much for bringing that information here.
Yes. And the thing is that when you talk to the dentist or you talk to the ENT or even lactation, they still see it through that lens of it's just a problem in the mouth. It's just a tie. And the parent sees it like that too. And their hope is, okay, so we're going to have the surgery, we'll get it cut and it goes away. But what they negate is that development that happened to the body and to the brain has been impacted on some level. It's the chiropractor who takes that 360-degree step back bird's eye view of like, okay, well, the tie is in the mouth, but what about the cranial bones above it? What about the nerves that exit? What about the throat and that fascial plane that's running down and affecting the whole movement and development of the body? And that's really the beauty of what I feel I add to these children is watching their milestones, watching them be able to thrive, because just because the surgery has been done does not mean that the neuroplasticity of the brain is done developing. And that's what we really enhance.
Fantastic. I so incredibly look forward to hearing you present. I know you'll be speaking Saturday morning during convention.
I think 10 a.m.
I believe so. I think you start off the morning for us. So just so everybody's aware, our convention is December 9th, 10th, and 11th at the Atlanta Marriott Northwest. We have philosophy and a casino night on Friday, as well as some speakers on Friday. And then on Saturday, we've got fabulous presentation from Dr. Marianne on this tethered oral tissue. I know her husband, Dr. Scott, is going to be talking about post-concussive syndrome. So I'm excited about that as well, because you don't even realize what you don't know until you start to learn it from people who really put this into practice in their offices. Saturday night, we've got a great philosophy panel. And then we'll wrap up on Sunday morning with the remainder of your hours for your CE renewal, for your license renewal. So 15 different speakers, casino night on Friday night. You've got to get registered for that, georgiachiropractic.org. But I would be remiss if I didn't remind you that we also have the Dr. Tim Langley Scholarship. So if you've got a student in chiropractic school right now, or you have peak students in your office, please send them to the website, georgiachiropractic.org, so they can find out how they can fill out an application for this scholarship. The deadline is coming up. It's December 5th. It's only about 10 days away. So they've got to fill out this application and get it submitted for their chance to be awarded a $1,000 scholarship for them to use for their education. So, Dr. Marianne, I'm excited to see you in person. I'm excited to learn more from your presentation. I think that you definitely are on the cutting edge of what doctors who want to focus more of their energy and more of their effort, more of their practice on a pediatric population. This is what we need to know right now. So thank you for bringing that to us.
Thank you, Kathy.
And thank you for taking the time to join us. Go have a wonderful rest of your week, a wonderful Thanksgiving with your family. For everybody watching us, have a great Thanksgiving, and we'll see you back here next week for GCC's Georgia Chiro Connection. Bye-bye, everybody.